Welcome to the Senior Hour, which is sponsored by Comfort Keepers in Home Care and Advanced Audiology. I'm Barbara Cochran with my co-hosts,
Dr. Jean Dorio
and Miles McNamara
on your hometown station AM-12. KHTS. I think I'd better go back to bed.
Well, you can stay at Hometown Station 1220 AM and 98.1 FM.
Very good.
That's too much of a mouthful.
That's right.
This is a show for, about, and by seniors, giving information to enhance one's quality of life. And speaking of quality of life, we have a lady here by the name of Elizabeth Mackas of Henry Mayo Hospital, and she is an outpatient physical therapist and...
yes, I'm the coordinator of the pelvic floor and lymphedema programs at Henry Mayo. So we're now, right there on the fitness center campus, and we have 11 private treatment rooms, and you get really one-on-one, hands-on specialty care at Henry Mayo now. So we have a wonderful program.
And so what does that second title mean?
So the second one is lymphedema.
What is
so
that?
That is swelling of an extremity because of a compromised lymphatic system. So often the most typical cause of that is cancer treatments. The surgeries and the radiation can cause adhesions and scar tissue, and they actually have to remove lymph nodes for good reasons to save your life. And then that can cause swelling in whatever body part that they remove the lymph nodes. If it's in the groin for uterine or ovarian cancer or testicular cancer or prostate cancer, then there's a chance of abdominal swelling, leg swelling, depending on if they take the pelvic or the groin nodes. And then, of course, breast cancer is very common. So if you take axillary lymph nodes, then their arm potentially could swell. So we try to avoid that.
And the people who have this problem understand what we're talking about, but the other side is people who don't have this problem, swelling in a limb especially becomes very uncomfortable. I mean, to where if it's in your leg, it's hard to walk. If you're right-handed and you use your right hand, there's swelling in that right hand, you become useless in trying to be able to use it.
Absolutely, and then you're putting yourself also, and so we treat regular edema issues like venous insufficiency edema, arterial insufficiency complications, people post-stroke or people in wheelchairs with swelling, and all of that. Anytime there's edema anywhere in your body, it puts you at very high risk for infections. So, and that's obviously what gets people in and out of hospitals. It causes lots of complications in people's lives. So anytime we can help people to manage their edema, then we absolutely help their quality of life. And the problem is a lot of times patients only think that you can just, if you can't pull a garment on, a lymphedema sock or a compression hose, then there's no help for you or no hope. But that's absolutely not the case. We have lots of different there's lots of different choices and options for edema management. We do a lot of manual therapy. We do a lot of, we do advise on compression garments. We use lymphedema pumps. We have cold lasers. We have physio touch, which is a moving suction. And I'm also in the process of trying to get a LymphaStar at the hospital. I'm very grateful the hospital is 100% supported. Every state-of-the-art equipment that I've requested, they have bought for our department. So it's been amazing. So we have the best lymphedema program possible.
Wow, that's
So I know the
incredible.
fitness, obviously at the fitness center, you don't provide medical care. So the program at the fitness center, you're either doing it in conjunction with treatment or to prevent treatment or post-treatment. How does the whole program kind of fit together?
It is completely wonderful there. I am so excited because what we do is when a patient comes in, they're evaluated by a physical therapist, and then the therapist determines at what level they can join the fitness center. So they're allowed to have a free membership at the fitness center for up to 12 weeks. If they're our patient, and then we work very closely with the exercise specialist at the fitness center, because then they can direct the patient to integrate into a normal, fun, exciting fitness program, but safely. And all of the exercise specialists that we work with, they have our cell phones, they talk to us regularly, and they have at least a 4-year degree. So there's absolutely no, weekend junkie, macho exercise specialist there that's going to be taking care of our patients. They're going to be knowledgeable and safe. And I mean, they'll come to us all the time. We have a good relationship because obviously we have a whole sports program, we have a balance program, physical therapy program. So.
But we have to make sure that our listeners understand, most of them being seniors, that, you say fitness center and it's 12-week membership for free, that it's not, the fitness center is not there to try to entice you to become a member of that fitness center. The fitness center is there for your therapy and your treatment. And that's what's
Yes.
really going on. The benefit of it, you get to be a member for 12 weeks. So
Yes.
it's a benefit. So I want our listeners to understand that, it's not like a lead into something else.
Yeah, and it's just pretty amazing when people see that, I think in general, seniors are intimidated and scared by fitness centers in general,
Absolutely.
and also like other ones, they are not really geared towards that. And I myself am middle-aged, and I like to stay super fit, and that's what the fitness center is geared towards. It's wonderful. It's a wonderful program, and then you get an experience. We have a pool program. We have all kinds of instructors that are we have a therapeutic yoga that specializes in getting disabled people with back injuries or neck pain or whatever their pain syndromes are, or lymphedema or pelvic floor dysfunctions. They'll be able to, we can work with that yoga instructor to help them find something that works for their body.
Well, I think the side benefit is that it introduces our seniors to the importance of exercise if they don't know already, because as we age, we have exponential muscle mass loss, we have bone density loss, and to really counteract that, you really need a program of resistance training, impact training to a certain level for the osteoporosis aspect of things. So if they're not introduced to the whole physical fitness aspect of it, a lot of times, there's that old sayings, we don't stop playing because we grow old because we stop playing.
Yes.
So it's really important. So it's probably a good introduction to the whole physical fitness aspect of their life anyway.
It absolutely is. And then when you're working with a therapist too, it can be done so safely.
And professionally.
Yes. And so that's the key. And then people don't give up, and they don't, they actually see that, this I can work out and feel good, and it doesn't have to hurt me.
Yeah, a lot of our patients don't understand that there are places where they can go to help manage the side effect from the problem that they now have from the hope of getting better and getting rid of their cancer. Now they have a place to go. And then, even 5-10 years ago, we did not have any place like what Henry Mayo offers in terms of therapy.
Oh, yeah, and it really is. I'm so excited because I worked there almost 16 years, so I was one of the first therapists hired when they reopened, and worked really, really hard to create a place where people with especially the specialties of lymphedema, edema issues, and pelvic floor dysfunctions can go to get help, and so it's very exciting.
And the debilities that are associated with these side effects from this treatment are high, and you mentioned and alluded to them before, but Miles, we both know that when patients don't become less mobile, that becomes a problem.
Right.
But if you're becoming less mobile because you have a debility from a side effect from treatment, that doesn't seem right. And like I said, a decade ago, we had no place to send these people. They did not do well, and their life totally changed. Their quality of life and their efforts in it went down the tube. So this is going to change a lot of our seniors' lives. They just don't know that it exists. That's the problem.
Right, and that's the thing. And we are getting so many doctors, wonderful physicians, cancer doctors, all kinds of doctors in the community that are on board with being a team. So I think that's a critical thing, is that our community is now providing services where the doctors and all other healthcare professionals are working as a team to bring the best quality of life back to a patient. Because after these cancer, initially the surgeries themselves can create scar tissue that limits range of motion and be very painful, and people are scared to move. They don't know what to do, any kind of surgery, since I'm a pelvic floor specialist as well. So I treat a lot of patients who've had abdominal surgeries of all kinds, or maybe hysterectomies, and we see all kinds of pelvic floor dysfunctions because of that, to get the quality of life after these surgeries. Even if it's a really great surgery, there's still complications sometimes.
Absolutely. So let's talk about to some of our listeners who might have had problems, some of the symptoms they might be getting post-operatively from pelvic floor types of intervention.
So, in general, what pelvic floor physical therapy does is we assess dysfunctions of the whole pelvic girdle, your SI joint and your hips and your lumbar spine in conjunction with the pelvic floor muscles. And so we're assessing anything that goes wrong basically with your penis, the testicles, the vagina, and the anus. And so that affects your bowel and bladder function and your sexual function. So it's very common we see women as they go into menopause having pain problems. So not only can the doctor manage them with hormones, but there's so much more that can be done with manual therapy vaginally. We can use internal electrical stim to try to get the health of your tissues back along with your whole normal exercise program. We do direct exercises to the pelvic floor. We also have lots of natural lubricants that we advise patients depending on what exactly their problem is and their history. We take into account all of that. Another really common problem with seniors is recurrent bladder infections. And as you know, Dr. Dorio, that's what oftentimes people ends their lives. They get chronic infections again and again. So the cause of that is that the vaginal wall atrophies. It gets unhealthy. And then the bacteria can get in so easily. So we have to just boost up the health of your vagina. And a lot of times older women think, oh, well, I don't use it anymore and I don't care to use it, you know? So it doesn't matter, but it does, because if your tissue's not healthy, you will start getting bladder infections.
Sure, it becomes a nidus for infection and then complications after that. That's correct.
Absolutely. And so so there's a lot we can do. Men with non-medical erectile dysfunction, we can help strengthen up the pelvic floor. And obviously we have a huge practice with post-prostatectomy patients.
Yes.
So we can help. We have, you know, if you think, well, I do Kegels because my doctor said do Kegels and it's not any better, I promise you that's not you will get way more than Kegels. That alone usually does not solve any problems.
Yeah, Kegels, for those listeners, are exercises that one to help supposedly strengthen the pelvic floor. But it's gone way beyond that, hasn't it, Elizabeth? In terms of the technology, understanding, with the hope that, you know, people can get back to a normal life. Because, you know, we're talking about mobility, but we're also talking about patients who will stay at home because they know they're incontinent of urine or stool. They're passing gas inadvertently, and that's no fun. That's embarrassing. So they don't go to the senior center. They don't go to family get-togethers. They don't go to parties anymore. They don't go out and be social anymore because they're stuck in their homes because of these aging problems that, you know, can have a solution.
Absolutely, and it's certainly much more common in women to talk about these things, but now that men are getting prostatectomies, even though the new robotic techniques are fantastic, and we have amazing surgeons, but still, you don't want to leak it all, you know, and you want to try to get as much function, the health of your tissues back, and we can absolutely do that. Another huge population of patients that we see is pelvic organ prolapse. You know, when your uterus or your bladder starts to drop, that creates all kinds of bladder dysfunctions as well as pain problems and leads to many surgeries.
And
so,
can you, you know, when you say drop, some people won't understand what dropping means, but it means the extension, like you can have your inside organs actually coming out of your body. That's a prolapse. And
Yikes.
Yikes, yeah. But it does happen. It commonly happens, and people don't know about it. And you alluded to how now these problems with men have, you know, started to be mentioned. It's only mentioned now because men don't say anything. Women have been open about their problems. Men have not been. And over the last few years, you know, men have come to the forefront and said, no, we're having these erectile problems, urinating problems. We're having these problems, and we want it recognized, and we want to be able to do something about it.
Absolutely, and that's why I'm so passionate about what I do, because it's such a wonderful thing. And even with the prolapse, if it's really bad, and like if a patient, a lot of my docs will send a patient saying, hey, you know, she's really nervous and scared about surgery, and you know, and her health is not very good. Let's see what you can do. So we will, for sure, even if they end up in surgery, we get the tissues so healthy that the outcome of surgery is so much better. So so it's a wonderful opportunity to ensure that if you have to, by the time I see them, if they're really prolapsed, maybe they'll need surgery, sometimes not, but at least they're going to go in there with for sure get a really good outcome. The best outcome possible.
And you know, I've seen the surgical procedures, and they are they're complicated, and they don't always rectify the problem.
Exactly.
And even if they do, then they come back. And if you already know how to handle it and strengthen those muscles, then it gets easier down the line to take care of it, and sometimes not even needing the surgery.
Well, that was going to be my question is, you know, as far as, you know, I always like the proactive approach versus reactive. At what age, I mean, you see a lot of folks, as I mentioned earlier, start to slow down and go, oh, I'm too old for that. When should a senior, you know, start thinking about Kegels on a proactive level? When should they start thinking about pelvic floor issues on a proactive level? What exercises should they focus on as they get into their 50s, 60s, and 70s?
Oh, well, they should be doing it from their 20s, but but absolutely, the sooner the better, and especially when women are of childbearing years.
Yes, when they've delivered.
Absolutely. I mean, that's when it becomes really important. So we have a whole pre and postnatal program. So you can tell your kids and grandkids, you know, that we can start then. You know, and just learning how to have good posture helps your bladder and your pelvic floor tremendously. Because once you start slumping, then all your weight of your whole body ends up hanging on your poor little pelvic floor ligaments. So having good posture completely helps your bladder and your pelvic organs. And then just learning how to contract that pelvic floor muscle. I usually start teaching a patient by breathing into their abdomen, and then when they exhale, as they exhale, then they can, when you blow out kind of hard, it will help you to contract your lower abdominal muscle correctly, and then you think about lifting your pelvic floor up like an elevator inside your body. That sort of helps you find that muscle, and the more you do that Kegel exercise, the more you'll be able to recruit that muscle when you need it in an emergency, like when you cough or sneeze or whatever, or when you're laughing. You just want it to become habit to always be able to grab that muscle and keep it healthy and do your Kegels.
Probably hand in hand, because also for balance for our seniors is that hand in hand with core exercises.
Absolutely, because your core is really your lower abdominal, transverse abdominals, and your pelvic floor together. And that creates the beginnings of your stability. So I'm a huge fan of functional standing exercises. Like for my own body, I do all of my weight training on balance stuff, because I know that I want to stay functional my whole life, and it's all about balance and keeping your core strong.
It is absolutely all about balance.
It is, and
and we need to take a short break. So we'll be back in a few moments to continue this incredibly interesting conversation. Wonderful. I'm Barbara Cochran with my co-hosts, Dr. Jean Dorio and Miles McNamara, on your hometown station, KHTS.
The best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top-quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
First impressions say it all. Choosing the right makeup is critical to that first impression and keeping your skin looking young and healthy. That's why Santa Clarita's Jen Gerard created Gerard Cosmetics. Inspired by women of all ages who gravitate toward classic and timeless beauty with a modern twist, Gerard Cosmetics. Superb quality and pigmentation, along with lip glosses and lipsticks in colors for everyone. The internationally acclaimed Gerard Cosmetics. Discover your new look at GerardCosmetics.com.
Santa Clarita's hometown station.
Now FM, 98.1 FM and AM-1220, your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-hosts, Dr. Jean Dorio and Miles McNamara, on your hometown station, KHTS. We're speaking with Elizabeth Mackus of Henry Mayo Hospital, and her title is too long for me to say.
Oh, come on. Let's all say it together. Pelvic lymphedema.
Yes, coordinator of the pelvic floor and lymphedema programs
Wow.
for Henry Mayo's physical therapy.
Well, how did you get involved in doing this?
Well,
what spurred
actually,
you into this?
Well, it is
career?
interesting because 25 years ago, almost 26 years ago, I became a physical therapist, and when a patient just said, my pain's inside. Now, I had never heard about anything, but my dad's a doctor, and my mom's a nurse, and I always hung out in the clinic, and my dad did pelvics, and I would always assist, and you know, it was just natural for me to put on a glove and go fix her. I didn't know what I was doing, but the Lord, I guess, guided me, and that was all she wrote. Then that was before there was an organization that started one pelvic floor class, so we made it up as we went. So now I mentor a lot of young therapists that don't have to do it the hard way, making it up. We have wonderful, amazing educational programs for therapists now to get specialized training in the pelvic floor and the lymphedema. So lymphedema, I tended to fall into anything that no one else wanted, or because it was really complicated or whatever, they just go to her schedule. So that's how I took on everything there, and I love it. I get bored easy, and I want to learn everything, keep learning, and you know, and it's exciting, and I love to help people with really bad problems. You know, I have a ministry with abuse victims, basically, and a lot of abuse victims, the reason I get to know so many is they have pelvic pain and pelvic floor dysfunctions, and I don't see them usually till they're an adult, but it starts in childhood, and they end up with all kinds of pelvic floor hypertonicity, and that is also leads to urinary retention and constipation issues. So that's a huge part of our practice, urinary retention, for whatever problem that might cause it. We see lots of men as they come into middle age that because they're sitting all the time in their jobs, they commute forever, you know, their pelvic floor, instead of getting headaches, neck pain, they get pelvic pain, their pelvic headaches in their pelvis. Their pudendal nerve gets trapped, and they start getting rectal pain, coccyx pain, penis pain, testicular pain. But usually they don't come get help until their penis starts to hurt. And so then
And that's all separate from prostate issues? That's from just sitting and coccyx
now,
issues?
They will oftentimes get diagnosed with prostatitis, but it has nothing to do with the prostate.
How interesting. Why
yes.
don't they use a different name then?
Well,
Like an earache that's
very
on your finger.
yeah. Well, they don't call, if it's a pudendal neuralgia or a pelvic floor dysfunction, it doesn't necessarily have to do with the prostate, but initially the physician might think that, so they'll rule that out, they'll try antibiotics, and then once they rule it out, I mean, thank God more and more physicians are learning and on board with finding a therapist, but patients usually find us online, and then they ask their physician, and their physician's like, great, go get help, you know?
Should our listeners then know, I mean, I'm assuming, and Dr. Dorio, you'd probably know this, when you go in for your full, thorough physical each year, is this something that's looked at, or do you say, hey, check my pelvic floor, or check my prostatitis? I mean, do you have to ask for these things, or is that part of a full workup?
And oftentimes, as Dr. Dorio knows, patients don't say things because they think maybe there's nothing they can do, or they're
Especially
weird.
guys.
Or they don't want to hear the bad news. It's
Right,
kind
or
of
they
put your
think
head
it's
in the
got to be
sand.
cancer.
Absolutely.
You know, they're all scared of the cancer diagnosis. But the more you tell your physician, the more they can refer you to resources. If you're having any bowel
But what
or
do we say, though?
bladder-
I'm sorry to interrupt. do we say don't leave any stone unturned? I mean, how do we say check everything?
Well, normally the doctor will check your prostate as a male.
Oh, I know that.
Yes, and they'll check for blood, the typical stuff. But if you have an abnormal pain when they do a rectal exam, tell the doctor. I mean, nobody likes a rectal exam, right? Because yuck. But if it's really painful, it shouldn't be. A vaginal exam, it shouldn't be painful. Right. So tell your doctor and say, I heard about physical therapy. Maybe I should go get evaluated.
Talk to me about my pelvic floor.
Yes, exactly. There's so much that can be done, and we have lots of home programs. We can get people on. We get partners and husbands and wives helping each other. I bring a person's wife or husband in and show them how to help. Let's be a team to help each other.
But I will tell you now, sometimes visiting your doctor is you snap your fingers and you're done.
Yeah.
And a lot of times
That's
they
true.
don't go through a 20-point review of trying to figure out things that are going on.
Which
I
is
don't
why
hear
we have
that
to educate ourselves and demand the time.
Absolutely. Just what you're saying, Miles, I think it's really important that, there are certain symptoms that one might get that you have to be aware of, that you will bring up with your doctor. I'm lost urine. I'm wearing pads now. It hurts when I have a bowel movement.
Yes.
And what is this thing protruding from my body? Things like that are just important that, people won't bring up. And I think it's, if your doctor is, in many cases, won't ask some of these more detailed questions, so you have to be aware there are symptoms that you might have that you have to bring forward right away. Bring in a list of things, or most importantly, if you're a caregiver or overseeing your loved one, you have to bring that list in for them.
Right, and one thing that is important, and I kind of picked this up early on in my Comfort Keepers days from an old friend you may remember, Donna Ashmore.
Oh, yeah,
she worked
from
over
the
at Henry Mayo's oncology. But
Yes.
like she said, and it's so true, aging is not a disease. So if your doctor says, "Oh, you're just getting old,"
Ooh, don't take that.
do not take that.
Absolutely.
Do not take that because that is not a diagnosis. "Oh, you're just getting old." Shake it off.
That frustrates me when I hear that doctors, and they do say that.
Yeah.
Yes.
So our listeners cannot walk out of a doctor's office with that explanation. They cannot.
Right.
Absolutely, and you have to be your own advocate, absolutely. And because I also grew up with a dad who's a doctor who is very passionate about his patients. He spent so much time, and I do miss those days for sure. But, the thing is, most doctors, if you make them stop, they'll be willing to investigate. They really are, and they want to learn. They want to help people. Even if they get in a rush, if you make them stop, they will.
One is what you said. You have to be your own advocate.
Yes.
You've got to drive your own health care. And with today's technology, and hopefully our seniors are staying up to date with like apps and things that you can do before you even go in. You should have your list. You're really the driver of your own health care. And just like you said, Dr. Dorio, don't take that, "Oh, you're just getting old."
Yes.
That's just, don't worry about that.
And also, a lot of seniors are really nervous about medications for good reasons. I mean, they're a gift from God when used appropriately, but you may not need one for your bladder. Come see us first, because we can urinary urgency, frequency. All of that stuff can be managed with physical therapy. Amazing.
When you touched on it earlier, is as far as early detection being the key, but what's the main reason folks don't go to the doctor? They don't want to hear bad news.
Bad news.
Right.
It's like, if I'm not told, it doesn't exist.
And then the
it's
other
too
side of the
late.
coin is that's usually the guys that don't present themselves with the problems. They're
Right.
worried about, maybe there's going to be another test. Maybe it's going to cost me more money. Maybe it's going to be painful. So all these things evolve from, especially guys, they just don't want to go in that direction. But let's take a hypothetical of a patient just asked me the other day. He was complaining about, not a diabetic, but complaining of urgency. And he said that he has to go to the bathroom, but he knows has to urinate, but all of a sudden it becomes an urgency, and he's got to, find the closest toilet. And many of my patients, from here to Los Angeles know where every place is that they can, have a toilet and go to the bathroom. So what would you say to someone coming in let's say someone who's 60 years old and say, I'm all of a sudden now waking up at night, and I went to my doctor and he said, I don't have a bladder infection, I don't have a prostate problem. What kind of exercises would you say you would do, or how would you evaluate a person that says, I'm running to the bathroom and I don't even know why, and if there were an earthquake, I would stop and I wouldn't have to go, but this urgency makes it so that I just can't hold it anymore.
Yeah, very, very common problem, and truly the restrooms can rule your life, and nobody wants to live looking for bathrooms. So a patient that comes in with these issues will evaluate everything, from checking the prostate tissue, checking the pelvic floor hypertonicity, checking for nerve adhesions from scar tissue. Women have lots of different kinds of surgeries for their uterus and their ovaries and their C-sections, and men also have surgeries very common that people don't think about. When they have their now my mind's gone blank. When they don't want to get pregnant. They don't want to make their wives pregnant. Vasectomy, yes. That is a common cause of irritating the bladder, vasectomy, scars, and adhesions. So the first thing I ask is that. And hernia repairs. Nerve entrapments from hernia repairs go right to the penis and testicles and irritate their bladders. So I always check the system. I check for bladder mobility and motility manually with my hands and make sure it's all moving right. And then the next highest culprit too is just the dyssynergy and discoordination between your bladder, your pelvic floor, and your brain. So when the brain starts panicking, then the bladder starts going like this, and if your muscle's too weak, then you do pee all over yourself. So the whole thing is you have to do the opposite of what's natural to calm down and not run to the bathroom. That's the best thing right there.
Is there such a thing as bladder training? I know people go to the bathroom a lot and they say, well, you need to train your bladder.
Yes.
How do you
for
train your
Foley
bladder?
catheters and things like that, we used it quite a bit when we had to, take Foley in, put it out so that they wouldn't require having the Foley catheter in the
What I'm
body.
assuming, though, it's kind of like, and to your point, Barbara, I think it's because the minute you feel a twinge of urination, you run to the bathroom. Well, now you never let your bladder really fully fill, and so it's kind of like that balloon aspect. You don't have, you never blow it up far enough. It's never going to,
Exactly.
Is that true? Is there any fact to that?
Yes, that is true.
Yes.
That is true because I've learned to do that myself.
Yes.
Because I drink a lot of liquid.
Yes, and a lot of people trying to be healthy drink lots of fluid and water.
That's right. And I'll get that little twinge, and I'll think, no.
Go to the bathroom.
Wait
Preemptive
a
strike.
minute.
Yes.
Wait a minute.
Yes,
Wait
exactly.
a minute. Stop and think about what you're feeling.
Yes.
Because you really have to know your body.
Yes.
You really do.
And then
And
when
you have
we
to be
add,
aware.
yes, and then when you add neurologically, the bladder relaxes when your pelvic floor contracts. So if you gain a really strong Kegel pelvic floor contraction, then it helps neurologically to relax your bladder. So recruiting that muscle is very critical. And if you can't find that muscle, that's when you come see us and we'll help you find it and we bulk it up. So it's super powerful muscle.
Yeah, because I'm guilty of that in the area of too much information, TMI. It's
Yeah,
like
yeah.
the minute you feel a twinge, preemptive strike, you just go.
Gotta go.
Well,
Yeah.
I got a wussy of a bladder because I don't make it work.
And you are so not alone. That's the thing. So people love to hear that, oh, okay, I'm not alone. This is
Right.
good.
Well, I think part of that is getting older.
That's not a diagnosis.
Oh, wait a
I
second.
said getting
Dr.
older.
Barbara.
I didn't say old. I said older.
Well, the way I look about it in Santa Clarita, too, because everybody, tries to look really young. They keep doing everything to stay young. So let's keep that pelvic floor healthy and young, too, And it doesn't have to be cosmetic surgeries, which there's a lot of that going around Santa Clarita for your pelvic floor. And you don't need that. You need healthy muscles, exercising, provide the proper nutrition to your vaginal tissues through natural lubricants. And we have lots of different ones depending on the patient that we advise patients. And I just had a visit from a wonderful physician who just moved in town and wanted to see our facility. She found me, called me. So really, we have this amazing new community of just a lot of influx of healthcare. We have buildings. We have a lot of healthcare in here now.
How does
to be a
Henry
team.
Mayo's Fitness Center blend in with someone who wants to be proactive? And let's say they're going to their doctor, not necessarily the Henry Mayo ER, but they want to start coming to Henry Mayo Fitness Center. I mean, I'm assuming it's open to the public. Anybody can join. And then they could be mentored and guided by folks like yourself?
Yeah, so if you want to just join the fitness center, you can. Anybody can get a membership there, and you just do that through the natural process. But if you have a specific question, sometimes, yeah, we can set up just a quick consultation. If it's something about the pelvic floor, I mean, there really isn't a quick consultation because, every day when I think, I totally believe the history is everything. If you really take the time to listen to a patient, I can almost diagnose it. But I can tell you, about every 10th evaluation after 26 years of doing this, I still
And
get something.
great lessons from your father.
Exactly.
And can it be
Obviously.
wrapped into
Exactly.
someone's health insurance possibly? If someone walks in and says, Dr. Dorio, I'm having frequent urination, and you're like, you know what, you need some pelvic wall work, let me
Yep,
prescribe you 12 weeks at the fitness center.
Insurance,
Will that
no,
do it? No?
you can't prescribe fitness center, but you can just physical therapy for pelvic
okay,
floor.
pelvic
It always
floor.
gets paid for.
Okay.
Yeah, absolutely.
Through Medicare as well.
Medicare,
especially.
and since we're hospital-based, a sort of nonprofit, we take almost every health insurance except for Kaiser. We even see FACI because we have a specialty of pelvic floor, and sometimes lymphedema. They'll send us special. They channel all their patients to us. So FACI we can see. The only one that we can't is Kaiser.
And they have their own facility out here anyway, right?
Well, yeah, but they don't really have
They
pelvic
don't
floor
fit-
therapy. So
nope.
switch your insurance if you have pelvic floor therapy.
Don't-
Sorry,
we're not
I'm
gonna
not allowed to say that.
advocate that, no.
Just they do provide one farther down south, so you just have to drive a lot farther.
Panorama City.
Yes.
So,
Yeah.
in terms of therapy, though, Elizabeth, people are listening and saying, "Gee, she has a nice voice," and you might have a guy say, "Well, I'd like to have her do some therapy on me." But there are some guys out. There's some
I
guys.
do get that. Well,
Some guys out there that will say, "Wait a second, I don't want a woman priding around in me," and women could be saying, "I don't want a guy priding around."
Well,
I mean, are there, women and men who are doing this therapy at your facility?
no, only women are the therapists that do the pelvic floor. It's, because if you have a guy, you're going to have someone else in the room, and people feel more uncomfortable with that. But honestly, I think my therapists are amazing, and they make you feel so comfortable. I have yet to have a man. I mean, at first and if the wives are nervous, I say, bring your wife with you.
Oh, good.
It's wonderful. It needs to be a team. But once they meet us and they feel comfortable, then they're not so nervous about the whole evaluation of their testicles and their penises. But there's all kinds of fascial problems that help in nerve entrapments, vasculature. When you get a Peyronie's constriction on the penis, you won't be able to get an erection as well, that we can manually release that. There's so many things that can be done. It's worth a visit, so overcome your shyness, and you will feel very comfortable with any of our therapists.
Wow, that's incredible.
And
I
how does one? I'm sorry,
I think we need to take
Okay,
another break.
I was going to ask her how we can
Yeah.
find her, but we'll do that after. On the
Okay,
other side.
After the break, yes. I'm Barbara Cochran with my co-host, Dr. Jean Dorio and Miles McNamara on your hometown station, KHTS.
Little Eye Leaders is the newest preschool in the Santa Clarita Valley. At Little Eye Leaders, our outstanding teachers lead with intellect, perspective, and heart. That means our programs provide a warm, nurturing atmosphere to meet the unique needs of each child. We believe that play is a powerful form of learning for young children. That's why our kids have every opportunity to learn through the magic and excitement of play. Parents, schedule a tour today by calling 303-0400 or online at littleeyeleaders.org.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
Now FM, 98.1 FM, and AM 1220, your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-hosts Dr. Jean Dorio and Miles McNamara on your hometown station, KHTS. And we've been speaking with Elizabeth Mackus from the Henry Mayo Hospital, outpatient physical therapist and
Coordinator of the pelvic floor and lymphedema programs.
We're going to make you say that by the end of the show, Barbara.
I'm not even going to try.
And something that just came to my mind, talking about leg edema, is a lot of seniors obviously have orthopedic surgeries. And those legs get really swollen, or shoulders or arms, and come see us and let us manage the edema. We have great orthopedic physical therapists, but they have access to us if they have edema issues. And we're actually having a continuing education course coming to our facility. We've had several. So we actually bring courses to our facility to train our therapists to be state-of-the-art and everything, up to date with everything. So we have an edema certification class coming to our facility this year, and is specifically focused for orthopedic therapists to learn how to manage edema better, because if you get the fluid out of your legs or whatever body part they had surgery on, then you will heal so fast, so much better. Edema is a nasty thing that creates inflammation of all kinds and trauma and stifles healing.
So if someone was self-identifying here today listening to this show, how would they say, you know what, I need to take the next step to either meet Elizabeth or find out what my pelvic floor is up to?
Yes.
So how do we find you? How do folks do the next step?
You will just call Henry Mayo Physical Therapy at 661-200-1550. But talk to your doctor first. You still need a referral. Now, we are, we're direct access. So in theory, a physical therapist could see you without a doctor's prescription. But my thing is, why do that? You need a team. I love working with physicians. I want the patient to get the best care. And the best way is to have a whole team, a medical team, working with you.
Well, cool. So focused on that pelvic floor.
And I'm not the only one. Remember, I have trained, and
you
they
have a
have
team.
Yes, and they're good. You do not have to ask for me. You just say you want pelvic floor or lymphedema. They'll get you with the right therapist. Or if it's an orthopedic thing with swelling, go to one of our orthopedic specialists. And then if there's something more complicated, they will call us in. I'm there all the time. So everybody calls me in for advice for everything, if there's anything that they need that they don't know.
Now, what about recently after discharge, kind of a side question, do you do any in-home physical therapy to get them able to come to you at the fitness center, or is they have to come to you first?
If you do in-home health, you cannot do outpatient health. So the insurance won't pay for both.
I see.
So so we don't do that ourselves. We're just strictly outpatient. So once the doctor gets you off of inpatient,
okay.
And a lot of times it's better for a patient to get off of inpatient faster and come to outpatient, because you get better faster, because we have all the right stuff.
So it is a precursor to coming to you, is they've got to do in-home physical therapy to get the ability to come to outpatient physical therapy.
Yes.
Right.
Yeah.
Okay.
But mainly if they have a problem and they listen to the show, even on a podcast or later down the line, they can get the information, they can tell their doctor, and the doctor can write the prescription to then refer the patient to the physical center.
Yes.
Fitness center. So, there are ways to doing this, but you really have to be your own advocate and have your ammunition ready to be able to talk to your physician, because when they just have those few minutes, it's easy for them to just write down and your symptoms and
check
the
boxes and run.
Yes.
But proactive, not reactive. It's really huge.
Absolutely.
Yes.
And if I may, speaking of being proactive, I want to just kind of plug something coming up at our senior center at the end of May. So get your to-do lists out, folks. This, as far as planning, it's there's a program at the senior center called Knowledge is Power, Aging with Dignity. And on May 31st, a Thursday, from 6 p.m. to 8 p.m., we're having advanced care planning. Do you have a plan? And our guest speaker will be from Henry Mayo, Miss May Ronci in May. That's interesting. But anyway, she will be talking about the palliative care program. She is the palliative care program navigator at Henry Mayo. So again, it's, a lot of folks are scared of palliative care. They are misinformed about hospice, but so anyway, put that on your calendar, folks. It's free. It's 6 p.m. at our Santa Clarita Valley Senior Center dining room. Free admission. It's over there at 22900 Market Street. And for information, you can either call the station here, or you can call me at Comfort Keepers, or just take this number down, which is to our senior center. It's 661-259-9444, because again, we do have to be proactive, not reactive. So put that on your calendar. And then lastly, a shameless plug. We talked briefly about Kaiser. I do have Aging with Power. I want to plug that. I'm coming a week from next Tuesday on May 1st. I'm having the Kaiser team on Aging with Power. They just opened a new facility here, so they've got two. A lot of times you don't have to drive over to Panorama City anymore. So we have a lot of Kaiser folks here in the Valley. So tune in to Aging with Power on Tuesday, May 1st. And then on a side note, just a proud dad moment, I'm giving the entire show to Kaiser except one segment. My daughter is in town, who's going to be a captain in the United States Air Force, and she's coming in town for a week before she gets deployed to South Korea. So I'm going to have her
South Korea.
Yeah, so I'm going to have her on the show. I told her she has to talk a segment to tell us about her Air Force and the promotion
great,
to captain, and give her a
That
safe
is-
bon
Congratulations.
voyage.
That's wonderful.
Yeah, that's
oh
great,
my
Miles.
goodness.
Thank you.
That is congratulations.
Very proud of her.
That's
That is
terrific.
awesome.
So again,
So we
that's
look forward to
Tuesday,
that.
May 1st at 11 a.m. right here on KHTS.
May 1st.
And Elizabeth, going back over your phone number again, it's 200-1550.
Yes.
For those who are interested and they want to be their own advocate but just can't seem to get through, but they can come to you and maybe get the information necessary to get that prescription and get things paid for.
Absolutely.
That's 200-1550.
Yep.
Henry Mayo Hospital. We appreciate your being on the show today. It's
Thank you very
fantastic
much.
information for our listeners, and I think you've made a lot of advocates out there. Thank you.
Yes,
Thank
good.
you so much.
Thank
we are
you.
sponsored by Advanced Audiology and Miles McNamara, Comfort Keepers in Home Care. Listen to us next week on the Senior Hour. Now go and advance your holiday. Go and enhance your quality of life.
Take two.